privileged to have that you are here today with us. Just a brief history, we started from Lahore with only 14 ambulances. And today, this service, when we started in Lahore in 2004, has now rescued over 10 million victims, helpless victims of emergencies without discrimination and maintaining an average response by 7 minutes. So everybody said, it won't work, it won't. We were able to do this, and then we've expanded now today to the Tehsil level. The service has expanded to Khyber Pakhtunkhwa, Pakistan, others. And as it became difficult, and even during the COVID operation, when nobody was ready to go near, we started the operations, and we was holding the frontline responsibilities of responding to every emergency call, and we responded to around 23,000 emergency calls, COVID-related calls, and patients were actually evacuated and then shifted to appropriate facilities. Not just this, we also provided staff for the health department whenever they needed the support from the site. And then, God forbid, if there were certain deaths which did take place, to provide them a dignified burial, again rescue service was there, and about 4,000 plus burials were carried out by us in following the protocols. So this was all a challenge. And then the challenge came in as the traffic grew, we had to respond to the congested areas. We started this motorbike rescue service, and today this motorbike rescue service has rescued over 900,000, responded to over 900,000 emergencies with an average response time of 4 minutes, which is an achievement even internationally. So that's something that we've been able to do and maintain. This is from where we respond to the emergencies, and we respond to about 4,000 emergencies every day, and so far 10 million people have been rescued. We are really grateful to you for the support that we had from WHO when we started the Emergency Preparedness and Disaster Management Program. And the first printing of the first aid book was done by WHO Pakistan. So I think that's where the first time in Urdu we had the curriculum, and when the first batch was being trained, that was the book that we followed. So I think the WHO set the basic foundation for the start of this service. So we're really grateful to WHO Pakistan for that. We're also grateful to you for the donation that we received from WHO for the 50 bikes. I assure you that they'll go a long way in helping people and providing timely response in the congested cities, and providing the first responder and the pre-hospital emergency care which is required in these cities. So once again, on behalf of the Lahore and Punjab Emergency Service Department, let me express my gratitude and thanks to the WHO, not just when we started the service, but the continuous help and the guidance and the best practices that we've been able to learn from the WHO. Thank you on behalf of all the rescuers.
I'm delighted to be here today. I'm so much delighted to see all the great work done by all of you all under the wonderful leadership of the Director General, Dr. Iswan. When I came here, I felt that I have come to one of the best rescue operation centers in the world, if not the best. I am sure it is the best. I always tell the response to COVID-19 pandemic by Pakistan is great, excellent, outstanding, remarkable, unified, and unbelievable. And in that, the amount of work done by all of you all is really, really outstanding, truly admirable. When the data was presented to me about the operations, the motorbike rescue operation services, you respond within 4 minutes. I have not seen this in any part of the world. This is wonderful. I have gone to the training center a few times now. I have observed and witnessed how the trainings were done. I have observed how these heroes are being trained It is really, really wonderful. It is a very comprehensive training. That's why you are able to today support the citizens of this great country to so well to respond any emergency. So it's going beyond the health emergencies. Any kind of emergencies are being attended by all of you all. So that is really great. I don't think this is a time that I should go on talking about this. WHO is so much pleased to see all this wonderful work done by this great center. And we are trying to work very collaboratively and going to identify this center as a WHO collaborating center. Not only for Pakistan, but for the entire world. I'm sure Dr. Iswan, my next time when I visit here, he might be able to declare this as a WHO collaborating center. We are so much pleased, we are so much happy, we are so much delighted to get involved with this great center, involved with Dr. Iswan, involved with all of you all. And it is our pleasure and honor to hand over 50 ambulance motorbikes to this great center. I am sure this contribution is not a big contribution, but goes in a long way to support the rescue operation in Pakistan. I am sure that this center is not working only for Lahore or Punjab, it's going beyond that, it's for the country, it's for the country. And we are going to donate another 15 motorbikes to AJK and 15 motorbikes to GB to ensure the rescue operation is done in those two provinces as well. And I am grateful to Dr. Iswan. He has agreed to train 30 people from these two provinces to ensure the rescue operation in those provinces also elevated to the highest level. So let me again appreciate, admire all these wonderful heroes who are putting their lives to risk to serve the citizen, to serve the nation, to serve the country. So our great admiration on behalf of the World Health Organization to all of you all. And let me appreciate the great leadership by Dr. Iswan also. I think this kind of operation is not easy unless you have a great leader. So let me again bow down, salute to Dr. Iswan and all these heroes who are doing this wonderful job. Thank you so much.